I think the most important thing that patients need to realize is that cancer treatment can really affect a range of function. The range of treatments that we use, whether it's chemotherapy, surgery, radiation, or hormonal therapy, can all affect sexual function in a variety of ways. And it's very important that patients know they can ask their treatment team ahead of time, how might treatment affect my sexual function? It's really okay to ask that question. I think it's also very important that people say to their doctors or nurses, someone on the team, is there anything that I can do ahead of time to help manage some of those symptoms? I think that patients often don't hear about it. People don't feel that they can ask. Nobody wants to embarrass or make their doctor uncomfortable, and often it doesn't get talked about at all.
And what are some of the ways that treatment can affect patients' sexuality?
So obviously there's a wide range of possibilities, but for example, some of our treatments might put a woman into menopause. That experience can also affect sexual function, can affect them in the context of vaginal dryness, hot flashes, can affect how they feel about themselves, not just about how their body is functioning. And it's very important that women know that there are things they can do to take care of their bodies. Vaginal health and overall health and well-being are parts of sexuality, and women are really in a position to ask ahead of time, what can I do to manage some of these symptoms? So learning about vaginal moisturizers and learning about proper use of lubricants are important on the front end. So when a patient finishes cancer treatment and is feeling as though they and their partner might want to get started again, they have some strategies to begin with, so that they're not looking at discomfort or pain and then worrying after that, how much damage has there been and why isn't this easier? So really the idea here is that if you're proactive and that you learn about some of the strategies ahead of time, you're more likely to optimize sexual function later.
And of course this affects men too. You see male patients as well, and they're struggling with this as well. Is that right?
Sure. Absolutely. So there are the obvious culprits. We think about guys after prostate cancer who deal with erectile dysfunction and hormonal therapy that we put men on in order to manage what we call metastatic disease or advanced cancer, where we give them hormone therapy in order to get rid of all the testosterone. Well, as you can imagine, that's also going to affect libido and sexual function. And also lots of guys have experiences, for example, with just fatigue, other kinds of experiences, head and neck cancer, where people feel really either impacted in terms of being physically different or altered by things like loss of saliva, change in energy levels, etc. And all of these things, for both men and women, sometimes not obvious, can certainly affect relationships, including sexual function.
And you raise the issue of relationships. What about partners? How do they play into all this?
Well, certainly sexuality is a very multi-layered experience. It's not just about the mechanics or the physiology. It's about how we think and feel about ourselves, and it's also about the relationship. Sexuality is in many ways a co-constructed experience, and partners are often not part of that conversation on the front end either. So patients often don't know that they can ask their doctor about how this is going to go, and often don't have language to talk with their partners about it. Often patients and partners have a delicate dance in which they're really protecting each other by not bringing up the topic. Nobody wants to make anybody uncomfortable or make them feel pressured or worried, and at the same time it can often be the elephant in the room, so that partners are really struggling to figure out how to even get started again, how to talk about this. And people really need some language to be able to get going with that.
And I assume this process takes some time. It's not an overnight kind of a thing.
That's absolutely true. Like anything, it's a process. One thing I would say, that when we think about time, it's important not to wait too long to get some help, or at least to even start asking about it. I think that sexual function, I often talk about like exercise. When somebody's had some kind of traumatic insult to the body and they're not able to exercise and time goes by, they have some muscle atrophy and are feeling out of shape, it's not going to be to their advantage to just wait. But we really need to think about rehab and exercise in a very active way, in terms of taking first steps in order to get re-energized and reconnected with the body. Well, it goes the same way with sexuality. The longer that time goes by, often the problems become more profound, and often people then sort of become disconnected from their bodies altogether. They get kind of numb to the whole thing and lose a sense of desire, and libido wanes. And as you can imagine, that can very much be then a problem in the relationship. It's no longer an individual issue, it's also a couple's issue.